right, Charlie, we're going to come back to you. Support services that TGMC offers to improve and educate men about their health. Give us a few of those if you can.
All right, well, TGMC certainly runs a free blood pressure clinic, screening clinics, and on the 28th of this month, men can show up at the Terrebonne General. It's a nominal charge of $15, and they have a series of screening exams they do to include cholesterol, blood pressure, glucose, and a number of laboratory values and vital signs to be taken, and to give somebody an assessment of where they may stand in relationship to their overall health. And of course, the Cardiovascular Institute of the South works in conjunction with TGMC to do these monitoring procedures and so on. And TGMC is just one of 32 hospitals in the United States to receive the Premier Award for Quality in screening and healthcare prevention.
Okay, and Dr. Spearman, the cardiology and cardiovascular surgery, what effect does that have on a man's health nowadays? It's come a long way over the years.
It has. I would like to think the first effect it would have would be hopefully in the area of prevention. We can begin by educating every person, especially men, since we're talking about Men's Health Week, with regard to the preventative measures to hopefully help stem the development of these processes. However, in spite of that, in spite of our best efforts, it's going to happen. It's going to happen to people that think that they're not at risk for it. So therefore, it's very important, in spite of how good your health is, or how good you may think it is, that you follow with your family practitioner and your internist or your cardiologist, that you have regular yearly checkups and practice a healthy lifestyle.
What are some of the advancements? Every time I walk into that medical center, there's something new. What are some of the advancements that you work with and that are sort of making it have great strides in that field?
Well, the general trend these days is toward less and less invasive procedures. We've already seen a tremendous amount of development in this direction to begin with stents, catheters, and balloon angioplasties. The cardiologists are very good at that these days, and they can treat a wide variety of cardiovascular problems with that. Given the surgical side of things, which is of course where I live, minimally invasive surgery, in which we obviously the focus of all surgery is to do the surgery safely and to accomplish the surgery cure or the surgery therapy that we want. But within that realm, smaller incisions that hopefully will result in less pain and quicker recovery with equal outcomes.
What advice for the men out there just on general fitness and general health? What could you tell them?
I want to continue to emphasize the lifestyle side of things. I think people tend to compartmentalize health into exercising, eating. That is all a factor, but I think what we have to understand is that we need to focus on lifestyle. All these things combine to create a more healthy lifestyle. Then I think we need to also pay attention, as I mentioned before, to our family history, as well as follow the advice of your physicians.
Dr. Dearman, Charlie, thank you all so much for coming on board today. We appreciate it. All right. When we come back, we'll be in the Canada's kitchen, so don't go away. George will be standing by.